My name is Jim Gardner. I'm the Medical Director at Blackpool Teaching Hospitals NHS Foundation Trust. Today I want to talk about conditions that are not COVID-19 and get across the message that the hospital and the health services generally are still open for business as far as other conditions are concerned. To be honest, we're worried that patients who may be experiencing serious symptoms of chest pain or of potential stroke are not contacting our health services at a time that would be in their best interests. So the message is very clear. If you think you are suffering from the signs or symptoms of a heart attack or of a stroke or of a mini stroke called a transient ischemic attack or TIA, or other symptoms that you are really worried about, let's say dizziness or a high fever, then please get in touch with your health services. And that could be, if you think it is really life-threatening, by dialing 999, or that could be contacting your general practitioner as normal, and they will respond to you through telephone triage and manage your condition according to the story that you're telling them. So please do get in touch if you're concerned about these kind of issues. Another condition to think about would be concerns around cancer, and our cancer treatment services and our pathways are all functioning, and GPs are making referrals into the hospital about patients for whom they have concerns. So please do not ignore the kind of symptoms and signs of serious illness that you may experience, and please get in touch with our health services. So we've noticed a marked reduction in the number of children coming to the hospital and contacting our health services. And of course we assume that is because parents are worried about a potential risk of contracting COVID-19 at the hospital or other health service settings. And please be assured we're doing all we can to segregate patients who have COVID-19 from those who do not, and to keep our clinical areas safe. So again, if you're worried about a condition, for example for one of your children, please contact the health services in the usual fashion through your GP or coming to hospital or dialing 999, and those cases will be dealt with accordingly. I think one other issue is to think about friends, relatives, neighbours, and still continuing to check on them, please, to make sure they're okay. Of course, we are practicing social distancing, and we know we have vulnerable people who are socially isolating, but we still have a duty to our friends, neighbours and relatives to check that they're okay. And that, of course, could be a telephone call, it could be a knock on a window and a discussion at a distance down a pathway, but please remember these people and check up on them.